Many of the beliefs about safety, however, are based on studies from decades ago when marijuana was very different.
The cannabis that was previously used in the past, I think we think about the 1960s and 70s where it was more frequent use. The percentage of the THC at that point was like 2 or 3%. And now the regular percentage of THC in a marijuana cannabis product is, between 15 to 20% pretty regularly.
THC is the active chemical in pot that gives people the high they experience. With more states like Michigan legalizing marijuana use, newer, more relevant studies are beginning to come out. A Central Michigan University study finds women who use cannabis during the first months of pregnancy run a higher risk of having a low birth weight baby. Another study published in the Journal of the American Heart Association showed an up to 42% increased risk of heart attack and stroke with daily use, especially through smoking marijuana. That's why Michigan State University is opening a CALM lab, CALM standing for Cannabis Legalization in Michigan. This lab will look at the cardiovascular impact of longer-term, regular use of modern cannabis.
Definitely, cannabis has an effect on the cardiovascular system. We have like acute administration or short-term administration of cannabis. We see increase in heart rate. We see changes in blood pressure. But whether this sustained over like heavy use, this is something we don't know.
Lynn Roy is an assistant clinical professor of pharmacology and toxicology at the IU Medical School at Notre Dame. He says marijuana absolutely does impact the chemical makeup of the human body, some of it for the better.
The normal effects of cannabis are going to be kind of a combination of what we see with alcohol, some sedatives, and hallucinogens. So you're going to get the anxiolytic effects, so the reducing anxiety. You can reduce tension, stress relief.
Both Roy and Dr. Taylor agree on a dangerous misconception about marijuana.
Is that it's natural, therefore it's safe. Natural does not equal safe. It just doesn't. The difference between a medicine and a poison can be that's a very fine line sometimes.
Another area of agreement, the misconception smoking pot is safer than smoking regular tobacco cigarettes.
You're also breathing in when you smoke marijuana. So you're getting all those carcinogens, those hydrocarbons, you're getting tar, and in fact, you may be getting more.
More because most pot smokers inhale the smoke and keep it inhaled longer than cigarette smokers. He says vaping holds the very same concerns. That leaves edibles and oils or ointments, safer but with their own risks.
People will take an edible and then be like, well, this edible is terrible, I'm not feeling anything. And then they take more. And then they're in trouble because then they just get hit by a freight train.
Ultimately, the jury is still out on the safety of long-term regular use. In fact, Roy says there's no clear agreement on what constitutes long-term regular use because today's dosages so widely vary.
Is that really the takeaway from the whole thing, is we just don't know yet?
Yes, that really is. There's
on every level.
On every level.
Thanks for watching. Here's another story you may like, and subscribe to the WSBT 22 YouTube channel.